Mixing alcohol with pain medication is basically playing Russian roulette with your liver. And guess what? Over 100,000 hospitalizations in the United States every single year are linked to alcohol and medication interactions. That is not a typo. 100,000. Imagine filling a football stadium with people who thought one drink will not hurt and ended up in the emergency room. Still think that glass of wine with your prescription is harmless? Welcome to Think, where we make science simple and sometimes brutally honest. Today we are talking about the dangerous combination of alcohol and chronic pain medication. Sounds boring. Stick around. Because this is not just about pills and booze. It's about why your body might betray you faster than your ex did. Doctors say mixing substances is one of the most overlooked health risks, and yet people do it every day. Why? Because nobody thinks it will happen to them. Spoiler alert, it can. Let us be real, chronic pain is everywhere. Back pain, arthritis, migraines, you name it. Millions of Americans rely on medications like opioids, muscle relaxants, or even over-the-counter stuff like acetaminophen. And millions of Americans also enjoy a drink or two. Combine the two. And suddenly, your relaxing Friday night can turn into Saturday morning in the intensive care unit. But wait, why is this such a big deal? Because alcohol does not just add to the medication, it amplifies it. So think of it like pouring gasoline on a campfire. Sure, it looks cool for a second, but then your tent is gone. Let us break it down. Opioids like oxycodone or morphine, mix them with alcohol, and your breathing slows down. It's too much and it stops. Muscle relaxants like cyclobenzaprine, add alcohol, and suddenly you are drowsy enough to fall asleep standing up. Acetaminophen, the safe one? Alcohol turns it into a liver-destroying monster. Doctors call this combination the beast because it sneaks up on you. Studies show that even moderate drinking can double the risk of side effects. And here's the kicker. Your body does not care if it is just one glass. It reacts anyway. Let me tell you about Mark. He was a 42-year-old guy dealing with chronic back pain. He took his prescribed meds, had a couple of beers at a barbecue, and thought nothing of it. Hours later, he collapsed. Turned out his liver could not handle the mix. He survived, but barely. And now he is on a transplant list. That is not a scare tactic, that is reality. And Mark is not alone. Thousands of people every year face the same nightmare. So next time you think it is fine, I will just have one, remember, Mark. Now, I know what you are thinking, but my Uncle Joe drinks whiskey with his pain pills every night, and he is fine. Yeah. Joe also thinks microwaving fish at work is acceptable. Do not be Joe. Just because someone has not crashed yet does not mean they are safe. It is like saying, I have driven without a seatbelt for years and never had an accident. Cool story, but physics does not care. So here's the recap. Alcohol plus chronic pain medication equals danger. Opioids and booze. Breathing problems. Muscle relaxants and booze. Extreme drowsiness. Acetaminophen and booze. Liver damage. Doctors say the safest move is simple. Do not mix. Studies showed the risks are real, and the consequences can be life-changing. Your body's not a chemistry experiment, so stop treating it like one. Now, it is your turn. Have you or someone you know ever had a close call mixing alcohol and meds? Drop it in the comments. I want to hear your stories. And if you found this video eye-opening, check out our next one on safe medication practices. Think is not just about videos, it is about making science simple. So hit subscribe and join the conversation. But wait, before you click away, here's the big takeaway. Alcohol does not care about your excuses, and your medication does not care about your weekend plans. Together, they are a ticking time bomb. So if you want to keep your liver, lungs, and dignity intact, maybe skip the cocktail with your pills. Mixing alcohol with chronic pain medication is not edgy, rebellious, or cool, it is reckless. If you think you are immune, remember, so did Mark. Do not gamble with your health. Think smarter. Think safer. Think.